muscles of the forearm and hand. Tell me, please, what is this muscle? Deltoid muscle. What is it? Major. We cut this muscle because necessary to open thoracic cage. That is pectoralis major. It is musculus pectoralis minor. Then this is biceps. It is long head, and this is short head. And you already know that short head of biceps together with musculus coracobrachialis start from coracoid process. That is why this muscle, what is it? Coracobrachialis. And this is musculus brachialis. Clear it is. And what is this muscle? Triceps. It consists of long head, lateral head, and it is medial head. Unconus muscle impossible to see in this corp. What is this muscle? This is subscapularis. Very good. It is latissimus dorsi, and this muscle is musculus teres major. That is posterior wall of axillary cavity. Yes, and this is foramen. It is foramen quadrilaterum, and it is foramen trilaterum. Clear? Well, and now we continue to speak about muscles of forearm and hand. Muscles of forearm consist of anterior and posterior, and each of these group subdivides into superficial and deep. Superficial group. First of all superficial muscles start from medial epicondyle of humerus, and first muscle, this is here. This is musculus pronator teres. Musculus pronator teres is attached to radius and function flexion in elbow joint and pronation of forearm. Next superficial muscle is musculus flexor carpi radialis. This muscle, the same, starts from medial epicondyle of humerus and attached in the region of base of the second metacarpal bone. Next, musculus flexor digitorum superficialis, superficial flexor of fingers. This muscle, it passes below of retinaculum flexorum in canalis carpi, goes to fingers and subdivides into 4 tendons. It's attached to second, third, fourth, and fifth fingers, and each tendon separates into 2 branches and attached to medial phalanx, phalanx medius. It's attached to medial phalanx. And last superficial muscle, that is musculus flexor carpi ulnaris. This is. It passes above of pisiform bone and attached to os hamatum and base of the 5th metacarpal bone. One superficial muscle, it is absent, that is musculus palmaris longus. This muscle also starts from medial epicondyle and attached to aponeurosis, palmar aponeurosis, aponeurosis palmaris. And with the help of this aponeurosis, participate in flexion in radiocarpal joint. I not explained that flexor carpi radialis, it participates in flexion and abduction. Flexor carpi ulnaris, flexion and adduction. And long flexor of the fingers, musculus flexor digitorum superficialis, it participates in flexion, flexion of medial and proximal phalanx, and flexion of whole hand. They are superficial muscles. Now, deep. First of all, we can see this muscle, that is long flexor of thumb, musculus flexor digitorum, musculus flexor pollicis longus, long flexor of thumb. Next is musculus flexor digitorum profundus, deep flexor of fingers. This flexor it passes together with superficial flexor and together with tendon of long flexor of thumb through canalis carpi, then subdivides into 4 tendons and each tendon attached to the distal phalanx. Participate in flexion of phalanges and in flexion of whole hand. And last deep muscle, that is musculus pronator quadratus. Here it is, pronator quadratus, between ulna and radius. That is main pronator. I already said about pronator teres here. It is additional pronator, and main pronator, that is pronator quadratus. It is clear that it participates in pronation. Topography. On anterior surface, we have 3 grooves. One groove is radial, one groove ulna, and one groove is sulcus medianus. Radial groove, it is laterally from musculus flexor carpi radialis, between this muscle and this, and this. This is musculus brachioradialis, it is from posterior group. Between brachioradialis and flexor carpi radialis, that is sulcus radialis. Between flexor carpi radialis and flexor digitorum superficialis, sulcus medianus, and between flexor digitorum superficialis and flexor carpi ulnaris, that is sulcus ulnaris. Now, posterior muscles. Posterior muscles, I already said, the same consist of superficial and deep muscles. And superficial muscles subdivides into radial group and ulnar group. It is clear that radial group on the radial side and ulnar group on ulnar side. 3 muscles in radial group, they are musculus brachioradialis, this one, brachioradialis. Here it is musculus extensor carpi radialis longus, and this one, extensor carpi radialis brevis. Musculus brachioradialis starts from lateral epicondyle of humerus and attached to the radius, and it put hand in middle position between supination and pronation, that is, middle position. If we make supination, this muscle moves hand to middle position. If we make pronation, it moves hand to middle position between supination and pronation. And these 2 muscles, extensor carpi radialis longus and extensor carpi radialis brevis, it is clear that both of them participate in extension and in abduction in radiocarpal joint. Ulnar group. In ulnar group, we have the same 3 muscles, superficial muscles. They are musculus extensor digitorum, then, just a moment, this is extensor digitorum muscle. Each tendon subdivides into 3 bundles, 2 of them attached to distal phalanx and 1 bundle attached to medial phalanx. Next muscle, that is own extensor of little finger, that is musculus extensor digiti minimi. And last, superficial muscle, musculus extensor carpi ulnaris. Extensor carpi ulnaris participate in extension of the hand and adduction of the hand. And some deep muscles. First of all, musculus abductor pollicis longus here. Next is musculus extensor pollicis brevis. Next, musculus extensor pollicis longus. And musculus extensor indicis, own extensor for index finger. It is here. This is extensor indicis, this muscle. It goes to index finger. Last deep muscle, impossible to see, that is supinator muscle. It is between radius and ulna below from all of these muscles in the proximal part of forearm. Now, fascia of forearm, fascia antebrachii, above of all of these tendons, it has thick part and it has specific name, retinaculum extensorum. Retinaculum extensorum, it fixed tendons of all of these muscles, And under of this retinaculum, we have septum between muscles, between tendon of muscles. And we receive 6 canals under the retinaculum extensorum. In first canal, we have 2 tendons, tendon of musculus abductor pollicis longus and extensor pollicis brevis. In second canal, musculus extensor carpi radialis longus and musculus extensor carpi radialis brevis. In third canal, only 1 tendon, that is musculus extensor pollicis longus. In fourth canal, 4 tendons of musculus extensor digitorum and 1 tendon of musculus extensor indicis. In fifth canal, 1 tendon for musculus extensor digiti minimi, and in sixth canal, 1 tendon for musculus extensor carpi ulnaris. And last, muscles of the hand. Muscles of the hand consist of muscles of tenor, opposite to thumb, muscles of hypotenor, opposite to little finger, and middle muscles of palm, that is in middle group. Muscles of tenor, most superficial muscle here it is, that is short abductor of the thumb, musculus abductor pollicis brevis. Long abductor, I already said, that is here, that is abductor pollicis longus, and muscle of tenor, abductor pollicis brevis. Below of this abductor, we have musculus apponens pollicis. It's a help to make a position of thumb. We can attach with the help of thumb to a little ring finger, middle finger, index finger, to each of these fingers. That is musculus apponens. Medially, we have superficial and deep head of musculus flexor pollicis brevis. And last muscle, it is here. This is musculus adductor pollicis. It's participating in adduction. In hypotenor, most superficial muscle heat is absent. This muscle is under the skin usually. It is musculus palmaris brevis. Heat is, impossible to see this muscle, but this is musculus abductor digiti minimi, and heat is musculus flexor digiti minimi. And in palmar group, in medial group of palmar muscles, we have 4 musculi lumbricalis, that is thin, long muscles. This is first musculus lumbricalis, then, just a moment, that is nerves, and here it is, this one is second, then this is, just a moment, this is third muscle and fourth, that is, they are musculi, just a moment, this is musculus lumbricalis, the same. Musculus lumbricalis, they participate in flexion in metacarpophalangeal joint and extension in interphalangeal, this movement with the help of musculus lumbricalis. And last, interosseal muscles, musculi interossei palmaris and musculi interossei dorsalis. Dorsal muscles participate in abduction from third finger, middle finger, and palmar muscles, adduction. Dorsal abduction, palmar adduction. It is, that is all. I want to draw one diagram, and it will. It is bones of the hand, that is carpal bones, that is eminence carpi radialis, here it is eminence carpi ulnaris, and between them on palmar surface we have retinaculum, that is a ligament, retinaculum flexorum, and this retinaculum attach to bones of carpus and makes 3 canals. This canal, that is canalis carpi radialis, here it is canalis carpi ulnaris, and this canal, canalis carpi. In canalis carpi radialis, we have one tendon, that is musculus flexor carpi radialis, only one tendon. In canalis carpi ulnaris, it is only vessels and nerves. It is not so interesting today. Only you should know name of this canal, but muscles here are absent. And in canalis carpi, we have 4 tendons for superficial flexor, another 4 tendons for deep flexor, and 1 tendon for musculus flexor pollicis longus. And these 8 tendons surrounds with synovial vagina, that is common synovial vagina for all flexors. And this muscle has its own synovial vagina. Synovial vagina decrease friction between tendon of muscles and ligaments and bones. That is very good for movement of fingers, because this tendon under the retinaculum flexorum has synovial vagina. And if we draw another diagram, that is second, middle, ring finger and little finger. And here it is retinaculum flexorum, and this tendon continues with synovial vagina to the thumb. And this common synovial vagina, they are tendon of muscles, 4 tendons, and this common synovial vagina not continues to fingers, only it continues to little finger. Common synovial vagina goes to the little finger and not continues to these 3 fingers. And these 3 fingers has his own synovial vagina. That is why we have isolated synovial vagina in index, middle and ring finger, and synovial vagina from forearm continues to little finger, and from forearm continues to thumb. And what it gives for us, if you give blood from finger, which finger usually use?
Point finger.
Usually ring finger, sometime middle finger, and it is possible to use index finger, but never you will not see that somebody used little or thumb. Why? Because if you put infection here, this infection continues to the hand and to forearm. And from here the same, if infection come to this synovial vagina, it's spread to palm and to forearm. And if infection present here, it is a problem, but this problem only in the region of finger. It's not continuous to palmar surface of the hand and to forearm. That is why only these 3 fingers we can use if necessary to receive blood from these fingers. Okay? And last, in dorsal surface, here it is. No, this is retinaculum flexorum, I already said. And in dorsal surface, we have retinaculum extensorum. And here it is 1, 2, 3, 4, 5, 6 canals. First canal in opposite to thumb, 6 canal opposite to little finger. That is second, third, fourth, and fifth. In first canal, only 2 tendons. Tendon of musculus abductor pollicis longus and extensor pollicis brevis. In second canal, musculus extensor carpi radialis longus and brevis. In third canal, musculus extensor pollicis longus. In fourth canal, 4 tendons of musculus extensor digitorum and 1 tendon for musculus extensor indicis. In fifth canal, 1 tendon for musculus extensor digiti minimi, and 6th canal musculus extensor carpi ulnaris. This diagram not necessary to draw, it is only for your understanding, but you should know names of these canals, which tendon passes through this canal, and heat is the same. Clear? That is all. Muscles of forearm and hand and topography.